Welcome to my YouTube channel. My name is Yomna Imam Muhammad. I graduated from the Faculty of Pharmacy, and this search videos for pharmacy students or fresh graduates who are suffering from knowing more about common case query pharmacy in an organized way and cannot even take one step. So, in this search videos, I will discuss more about common case query pharmacy like headache, heartburn, mouth ulcers, and others, and how to deal with them. Like when you have to refer to a doctor and when you can manage the case in pharmacy and by which treatment. So, here is the list of topics I will discuss. Topic number 1 is heartburn. Topic number 2 is indigestion, and it's also known as dyspepsia. Topic number 3 and 4 are constipation and diarrhea. And all of these topics are related to GIT problems. Other topics that are related to respiratory tract like allergic rhinitis, and it's also known as high fever, cough, even dry and wet cough, common cold, and influenza. And it's very important to know the difference between influenza and common cold. Other topics like headache, mouth ulcers, sore throat, and others. So, if you are interested, just keep on watching to know the points for each topic. Point number 1 is general information about the disease, like symptoms and causes. From symptoms, you can diagnose the case. For example, if someone came to a pharmacy and asked you for treatment for a burning sensation in the stomach and the pain passing upwards, from these symptoms you can diagnose the case with heartburn. So it's very important to know the symptoms of the disease, and also it's very important to know the cause of the disease. For example, if this patient who is suffering from heartburn is eating too much fatty food, so the non-pharmacological advice will be don't eat too much fatty food, especially before sleeping. So it's very important to know the symptoms of the disease for diagnosis, and also it's very important to know the causes of the disease to determine non-pharmacological advice. Point number 2 is how to gather information from patient by as method technique, and in as method technique it is abbreviation for what. So let's start with letter A, which is abbreviation for age and appearance. So you have to ask the patient, how old are you? Because as we all know that the management of the case is different for children, adult, and elderly. So it's very important to know the age of the patient, and also the appearance is very important. The next letter is S, which is the abbreviation for self or someone else. And this point is to prevent misunderstanding, because as we all know that in the pharmacy, not all the customers are patients. There may be someone else from patient's family. So this point is very important to prevent misunderstanding. The next letter is M, which is the abbreviation for medications, especially current medications. And this point is very, very important for 2 reasons. Number 1 is that the symptoms that the patient is suffering from may be a side effect for one of patient's current medications. And also, there are a lot of drugs that causes drug-drug interactions. So this point is very, very important. You have to keep it on your mind. The next letter is E, which is an abbreviation for extra medicines. So you have to know if this patient tried any other medicines to treat the symptoms or not, and if the answer is yes, you have to know more about this medicine, like dose, concentration, and how used it. The next letter is T, which is an abbreviation for time or duration of symptoms. For each disease, there is a specific time that if the duration of symptoms exceeds, you have to refer to a doctor. And the next letter is H, which is an abbreviation for history, even family history or history of symptoms, or a history of how this patient relieve the symptoms. And the next letter is O, which is an abbreviation for other symptoms. And this point is very, very, very important. For example, if someone suffering from a burning sensation felt in stomach and the pain passing upwards between breast bones, and the other symptom is the pain radiating to arms. So it may be a sign of heart attack, and you have to refer this patient to a doctor, because you cannot definitive diagnose this case with heartburn, and you have to refer this patient to a doctor for more investigations. And finally, letter D, which is abbreviation for dangerous symptoms. That's all about point number 2. The next point is treatment time scale. That if symptoms have not responded to treatment after this treatment time scale, you have to refer the patient to a doctor. And finally, point number 4, which is management. Management by 3 ways: by OTC drug, or by non-pharmacological advice, or by referral to a doctor. By the way, you can manage the case only by non-pharmacological advice. So, if you are interested, I want to ask you a question: if you prefer this year's videos to be in Arabic or in English, or mix it between both English and Arabic. That's all about the intro. Thank you for watching, and see you in the next video.